Hi, and welcome to Healthy Living. I'm Dr. Donald Pelto. Today we're going to go over everything that you would want to know about bunions. Some people simply don't exactly understand what a bunion is. If you have someone in the family with a bunion, you would know. There's a bunion that can happen on the big toe. That is the most common type of a bunion that people have. And then there's also something called a tailor's bunion that we're not going to talk about today, but it's a bunion that's on the outside of the fifth toe. And what is a bunion? Well, basically you can see in this foot, a bunion is where this bone points out this direction and the toe kind of points in the other direction. You might be wondering what causes bunions. Well, bunions typically are from your parents or from someone in your family. Maybe it's not your parents, it could be your grandparents, it could be someone in the family that has had bunions in the past and you got it because of hereditary. It may also be because of the same type of a foot type or body type that makes you more predisposed to getting a bunion. The technical explanation is a mechanical instability. Okay, so your unstable foot or tendons, they pull harder on one side than the other. So a few examples. If you have a very flat foot, the tendons are going to pull at a different angle. If you have a high arched foot, if you wear a shoe that's very tight, it's going to cause the tendons to change a little bit in the position. It tends to get worse over time. This is a question that many people ask. They'll say, well, I'm at 30 years old or I'm at 50 years old. Will it get worse? Bunions tend to get worse over time. So if you're 18 years old and your bunion's very bad, you should probably consider getting it fixed. If you are 50 or 60 and your bunions is just starting to hurt, it's probably not going to get much worse over the next 10 or 15 years. You also have to be careful of what types of shoes that you're wearing. Many people have bunions, or the bunion can be contributed to from wearing a poor shoe. And what's a poor shoe? A shoe that's very, very tight in the front that kind of pushes that toe over. So if you're wearing a shoe, as you can look at this one here, imagine those pointy shoes that are worn. That shoe pushes over the toe. A lot of times that little shoe isn't going to cause the bunion, but it could make it progressively get worse quicker. Let's look at the different types of bunions. When you want to look at your bunion, you should look at the bunion when you're walking and when you're standing. So when you stand up, sometimes it changes. Sometimes your foot may splay open as you stand. And also you want to look at how you walk, because when you walk, sometimes you hit in a different position. And very common, people have these calluses on the side of the big toe or on the side of the big toe joint. So when you look at bunions, you basically look at them. There's mild, there's moderate, and then there's severe. When you get into the severe category, what happens is that this big toe here, it tends to overlap this second toe. This is a very, very severe bunion. Now, just because you have a mild bunion, it doesn't mean that it doesn't hurt. You may have a mild bunion and it's very painful. And there are some people that have a very severe bunion, but it doesn't cause them any pain. If something doesn't cause you pain and if it's not bothering you, you don't have to have it fixed. If something is very small but really bothers you, it's something that you could consider having fixed. One thing we also look at is we look at certain angles on the x-ray, and x-ray is very important. You can't determine to fix or not to fix a bunion without looking at the x-ray. The x-ray gives us a visualization of the angles of the bones. Okay? There are some other common problems that coincide with your bunion. So for example, you could have a bunion, but sometimes you can have this other bump on the side that we talked about is a tailor's bunion. That makes your foot extra wide. So it's wide because of these bones and it's wide because of these bones. You also may have these toes that are curved down that are called hammer toes. And hammer toes, many times, they also have these little calluses on top from rubbing on the shoe. And you may also have different types of forefoot pain. Specifically, the area of pain that tends to hurt people are underneath these bones, underneath the metatarsal heads, that can become painful. Kind of a simple way to explain it is that if you have this bone right here, this big toe joint in this bone, this is called the medial column, or one side of the foot. So this side and this side, they kind of move independently. So if you look, when you're walking, many times this big bone kind of pops up or lifts up when you're walking, and it puts more pressure underneath that second bone. In combination, this hammer toe, when you have a toe that's cocked up, what happens is there's more pressure on the bottom of that bone, and that can be another problem that can happen with bunions. How do you treat bunions? If you come into the office and it's hurting you a lot, it's either because there's inflammation in the tissue around the bunion, and what I mean by the tissue around is, you see this little red spot right here? So this is the tissue around the bunion that can become painful. This redness, okay, this doesn't look like gout. Gout would be all red all around the joint, but this redness is typically caused by wearing a shoe that's inappropriate. A shoe that would be rubbing on that area, it would cause some inflammation in the tissue or the capsule that's around the joint. There's also pain that can happen inside the joint. So inside of the big toe joint, there's a joint surface that it moves. The joint moves, and that could become inflamed. What we call that is usually arthritis. So it could be either from arthritis in the joint, or it could be from on the side of the joint. And sometimes it's difficult to tell. If you take that joint of the big toe joint and you move it up and down and there's no pain, but you push on the side and there is pain, it's more likely that it's pain from that capsule. But if you have no pain when you push on the side, but when you move it, it's painful, that could be arthritis or even some inflammation inside of the joint. How do you take care of that inflammation? Well, most people, before they come into the office, they try putting ice. You can take ice and put it on for 15 or 20 minutes, a couple of times a day, and that may calm down the inflammation in that area. You could also take some type of an anti-inflammatory medication if your doctor will allow. That can reduce the inflammation inside the joint and around the side of the joint. Resting the foot is very important. Resting, it could either be staying off your foot, but more importantly, it's changing the type of shoe to not wear a shoe that would aggravate that area. The aggravation from the shoe many times is the culprit. So for example, if you do a 5-mile walk for a charity and you're wearing a new shoe, it could rub and cause that area to get inflamed. If you get a brand new shoe because you're going to a wedding and you wear that shoe for a couple of hours, that could cause some inflammation. Many times bunions that are not painful and they become painful is due to some type of activity or some type of shoe that causes it to get inflamed. So you have to be careful of the shoe type and the type of shoe and the type of activity that you're doing. Another example is if you're doing a lot of squatting and a lot of kneeling, that could cause aggravation to the joint in that area. One thing that can be done at times is something called a cortisone injection. Now, no one likes a steroid or a cortisone injection, but these can be very, very helpful, especially if there's inflammation around the side of the joint or inflammation in the joint. Basically what you do is you prep the joint with something to clean the skin, and then you inject a little bit of medication either inside of the joint or around the joint. We don't like to do too many of these cortisone injections because sometimes they can weaken the capsule around the big toe joint. But cortisone is very effective at reducing pain, at reducing inflammation, but everyone says, well, I constantly need cortisone injections. I typically recommend doing maybe 2 to 3 per year if needed, but if there is a lot of arthritis in the joint, you may be looking at some other type of a treatment for your bunion problem. The second thing you should do is to reduce the irritation. Irritation is typically caused by a shoe, for example, the shoe that is tapered in the front. Do you see how this shoe pushes this big toe over? And then it could rub on the side. And here's an example of a shoe that does not. There are a lot of different types of shoes that are called minimalist types of shoes. There's a lot of name brands, but you see, the main thing I want you to notice is that this toe goes over to the side because of the shoe, and this toe goes straight because of the shoe. A lot of times shoes, wearing them over time, can be the culprit of this. There's a couple of types of pads and spacers that people can wear. There's a simple spacer that goes only between the big toe and the second toe. By wearing this, it's going to help align the big toe joint, and it's going to make the rubbing to be in a different place. Now, I want you to understand that wearing one of these spacers isn't going to resolve the bunion problem. It's not going to realign it and make it stay that way. Whenever you wear a spacer, it's going to realign it temporarily, but when you take the spacer out, normally it goes back into that position because the joints and the tendons have tended to adapt over time. If you want to go something a little bit more than this spacer, there are spacers that go through every single toe. This is something called correct toes. And the correct toes, these were actually made to wear in a shoe like this. So you would have these spacers between all the toes, and you would wear them in a minimalist type of a shoe. Correct toes can be very beneficial for helping it not to be aggravated and helping the joints to move a little bit better. Now, if your problem is only pain on the side of the big toe joint, there's also, like you can see on the side there, there's this basically just a gel pad. It could be a fabric pad. There's a lot of different pads and spacers that you can try. I find that many people, they come into the office and they have a painful bunion and they say, "Doctor, you know, I've tried 10 pairs of shoes." Well, if you've already tried 10 pairs of shoes, the problem probably isn't the shoe. If you've spent $50 or $100 on different types of spacers and nothing really works, then the problem probably isn't the spacer that you're using. You probably need some other type of treatment to calm down that joint. Another thing I'd like to talk about is correcting the heel alignment or correcting the joint alignment. Supportive shoes can be helpful. There are certain types of shoes that actually have laces that are on the side. Do you see how the lace is moved over the big toe joint? Okay, there's different types of shoes that have laces on the side, so if you have a bump on the top, that's more of an arthritic problem, but sometimes that can help the joint to move better. There's also an adaptation. You can see on this picture on the bottom right-hand corner that there is a cutout underneath the big toe joint. As I mentioned before, sometimes the big toe joint can change the way it's moving because of the bunion. And if you do the cutout, it can allow that joint to move a little bit better. And this tends to be done with something called an orthotic. In orthotic, it's going to stabilize the heel position, give you some support in the arch, and it's going to allow this big toe joint to move better and to have less jamming. Some people with bunions and other types of joint problems in the big toe joint can have this jamming that can be painful. Sometimes an insert can help that. Just by pushing up a little bit more in the arch, it can take some of the pressure off that area in the big toe joint. If you are in the summertime or in a place where you can live where you don't need to wear shoes all the time, many times sandals can be more comfortable if you have a painful bunion. Now let's talk a little bit about the reasons for surgery if you have a bunion. I usually limit it to 3 reasons. If you have skin breakdown, what that means is if you have an area on the big toe joint or between the toes that breaks down, causes irritation, causes pain, or even an ulcer, that may be a reason for you to have surgery because that skin breakdown could be a problem in the future. If you have pain in the joint, pain on the side of the big toe, pain that doesn't get better with doing the things that we talked about previously, pain is a good reason to have your bunion fixed. And then also if you can't find shoes. Some people, they've tried a lot of different shoes and even the wider shoes aren't comfortable. Nothing is comfortable for you. That's also a reason that you could consider a bunion surgery. Here's a couple of examples of a mild bunion, of a moderate bunion, and of a large bunion. And there's different types of corrections, but you can basically see the whole goal is to straighten out the big toe joint, and each of them is done with a different type of a surgery. I put together this personal website, and I'm going to put this link in the bottom of the video that's going to give you some information about the condition, a place you can post a question, share your experience, and things like that. This is a post-wire page that we do for our patients, and I want to show you what you're going to see. Basically, you're going to see a couple of documents. You're going to see the treatment process that I just talked about in a PowerPoint. Here's a simple patient handout. And here is a patient's guide to bunion surgery. So if you're considering surgery from a doctor, you may want to look at this guide to surgery. It's a video. This is a video, and here's an actual little booklet that I put together with one of my other colleagues. It's a patient's guide to bunion surgery. It has all the common questions that you should ask and different concerns that you may have about bunion surgery. And then also here's some before and after x-rays as examples and different ways of staying off your foot during the surgery. And finally, I just want to do this little review process. This is what I like to go through with all my patients when we're talking about bunions. The first thing we want to do is we want to get an x-ray. And we want to measure the angle in the x-ray to see if it's within a normal, which is 0 to 8 degrees, or if it's a 9 to 15 or greater than 15 degrees. Because based on the angle, you would tend to do a different type of a procedure. Okay? Sometimes people that have that painful red knob on the side of the big toe joint, I might do an ultrasound just to evaluate if there's a bursal sac or a fluid sac in that area that may need to be drained or injected. Then some of the traditional treatments that people try, and I usually use this as a checklist. So if you tried this, and none of these work, then you may want to consider some type of a surgery. So have you tried icing and anti-inflammatories? Have you done a cortisone injection? Have you tried some physical therapy to see if that's going to help your joint? If you've tried that, have you tried wider shoes, a toe spacer, a bunion pad, custom orthotics? If none of those work, and you're still in pain, you may want to seek out a doctor to do a bunion surgery for you. Now, that's beyond the scope of our lecture today about bunions, but there are a lot of different things to consider, and I did put some resources for you to review on if you're considering bunion surgery, what to think about. But to keep it simple, there's different types of surgeries that can be done. You can do, if you're an older patient, there's something called a Keller bunionectomy, where it's only really to get rid of the bump and you're not that active. That's a good type of a procedure that still can be done if more people that are older and that are less active. There's a distal bunionectomy, which for a smaller with a mild to a moderate bunion, it's the most common procedure that can be done. And you may want to consider some of the additional procedures that you're going to be doing. For example, if you have a Taylor's bunion, or if you have a hammer toe, or if you have pain underneath the second bone, there's different types of procedures that go in conjunction with the bunion. For example, if you have a bunion and these other things, and you're going to be having surgery anyway, many times it makes sense to correct these other things that either are going to be problematic or could be problematic in the future. And there are other types of bunions that you may want to get a second opinion for. For example, if you need to do more of a proximal, that means a bunion higher up on the foot to realign things, or if you're going to be doing a fusion, if there's a lot of arthritis in the joint and you want to stop that joint from moving. So here's some basic things to look at when you're looking into bunion surgery, and I hope you have enjoyed this video. Thank you. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.